Hey, so welcome to my channel. I'm going to be talking to you guys in this video about what health content writing is. If you like this video and what you hear, please subscribe. You can also follow me on Instagram at Millennial Nursepreneur. So I have some notes because I am really good at forgetting things. And I really want to make sure that I cover everything in this topic about health content writing and what it may look like for nurses or other healthcare professionals who are interested in getting into this. So a little bit about me. I started my health content writing business in 2022. I really kind of struggled a little bit in the beginning trying to understand exactly what type of content I wanted to write and how often I wanted to write. I'm also a nurse that still has their day job, so I'm hoping that you guys understand and I can lead by example when I say and show you guys that you can do this content writing at a PRN or as needed or part-time basis. You don't have to quit your day job to get this started. So okay, first question, what is health content writing? Really, it's health content. It's just that simple. Some people think it's going to be like this crazy, scary or unknown thing that they've never heard of. But if you think about health content and where you go, like let's say, for example, I have asthma, and let's say I wasn't a registered nurse and I wanted to know more about it. If I put in the Google search engine asthma, there's going to be all of these articles that are going to come up, and they are going to give you maybe the signs and symptoms of asthma, what causes it. There might be some treatment options, all in this one article, all jam-packed in there. And that is health content. And a lot of people don't realize that it's just that simple. Okay, question number 2. Who writes health content? This is a loaded question because the reality of it is anybody can write health content. I know that sounds really kind of scary, but you have to think about health content and the fact that it is a form of journalism. And so you don't necessarily need a background in journalism or in healthcare to write about health content. Maybe you stepped into health content because you have experiences with certain medical conditions and you want to teach a larger audience about that specific condition and how to live with it. So people who typically write health content can be journalists. They can also be freelance writers with no background in journalism. But then there are also healthcare writers, healthcare content writers. So people with a medical background, that can be physicians, that can be nurses, that can be dietitians, that can be physical therapists. It really just depends, because you can write this content, and as long as you have an authoritative voice and can demonstrate that you have some experience and or expertise in the content, essentially you can write it. But this video is more targeted towards healthcare professionals who may be thinking about writing health content. And I'm starting this because this wasn't around when I was looking for more information about health content writing from a healthcare professional's perspective. Next question, what is the schedule like? So I told you guys I have a day job. I am a researcher, a nurse scientist by day. And so I already write a lot, but my schedule really varies, and it varies based on my client needs. So essentially what happens is you go and meet clients, whether that's through social media or places like LinkedIn or maybe a conference or some other networking event, and you are telling people that you're a content writer and maybe you've got a portfolio of some pieces that you've written or a blog that you can refer people to so they can see your writing style. And really what happens is that a client will ask you to come and start writing content for them. Maybe they ask you to do a test piece and then they say, okay, well, we need you to write more, or we would like for you to write more. And so what happens is that you and the client go back and forth about how many articles you can write per month for them. And so the schedule will always vary. Doing this at a part-time rate, I typically try not to write more than 2 articles a week. And that's because it can take some time. You know, you need to make sure that you have time to go and get sources if you need to interview anybody, or if you just need time to do the actual research. Another question that I've heard a lot, what is the pay like? And also a very loaded question, because that also depends. That will depend on you and how well you sell your services. I'm not gonna lie and say I have not written for free, because I have only done it once. I may or may not do that ever again. I don't know, time will tell. But it varies based on you. So one of the things that you'll learn as a brand new freelance writer is whether or not you want to create your own pay rates based on things like having a flat fee or a flat rate, or maybe you are charging your clients by the hour that it takes you to write your assignments, or maybe you are charging by the word. There's no necessarily set standard for pay rates. This is one of the things I've actually struggled with, and I know other freelance writers in and out of healthcare have also struggled with this, especially when you don't have a background in business. So this can be a little bit challenging, but it's definitely something you can get over. What are the main types of content writing? Well, there are 2, and really this is dependent on the audience that you are targeting. If you are writing for a client whose audience is a business, we call this business to business, B2B, meaning that your content is going to be targeting other businesses and you're going to write for a business. So essentially you can think about people or companies that, for example, in healthcare, companies that create medical devices or medical supplies. Who is their target audience? Who's typically giving them money for their products? Hospitals. So businesses may hire other physicians and nurses and other healthcare professionals to write blogs and articles and selling pieces for products that are targeted towards another business. The other audience that I typically choose to write for is the everyday consumer, or consumers, B2C. And really that is, again, that everyday content that you see in a Google search engine when you put in a specific keyword. I prefer to write for clients who are targeting consumers, because I have worked in the hospital and I have seen so many people come in with the same medical conditions, and oftentimes the same problems happen. They came in because they ran out of medication. They came in because they weren't able to communicate with their provider about changes that they're feeling, and maybe they ran out of medication, or they moved and they weren't able to communicate that with their provider. You see a lot of complications in the hospital around things that can sometimes be prevented, and that is why I love to educate the public through content writing, or specifically through B2C. That is it for this first video. If you liked what you heard, please subscribe below. There will be additional videos coming at you very soon.